talking about jiu-jitsu, and with you being a microbiologist, I can't not ask you about it.
Absolutely.
And especially with what's gone on lately with an absolute legend of the sport, a man who I am named after being the Funk, Ben Askren, sadly ends up in pneumonia with a staph infection. And I think there's a lot of misconceptions around staph, especially within the jiu-jitsu community. So what do you know about staph, and what interactions have you had with it across jiu-jitsu and in the hospital?
Sure. So when we're talking about staph, we're talking about Staphylococcus aureus. There are lots of other staphs. Staph aureus is the main one that causes disease in humans generally. There are some others, but generally that is the one that we mean. And certainly when we're talking about staph in jiu-jitsu, it's Staph aureus that we're talking about. Probably a half, maybe more, of people are colonized with it anyway. So so probably in this room, at least one of us, probably both of us, because we both train, have this on our skin, living commonly up your nose, armpits, but anywhere on your skin, really. It lives there, and as long as it's on the outside of your skin, doesn't cause any problems. It's there. When your skin is broken, which is the main way, but also if you've got problems in your nose, problems in your mouth, anything that breaks that barrier and it gets access, that's when it's trouble. So and that can arise in various different ways. So it can cause a kind of cellulitis, which is an infection of your skin. So that again is when we're talking about kind of gym staph, that's generally what people mean, like a cellulitis type picture. So inflammation of the first few layers of your skin. Essentially, that's when it's big, red, angry, hot, painful, and that needs antibiotics. You won't cure that any other way. That needs usually flucloxacillin, and that's a big problem. That can progress. So that's like one level of it. If it gets into your bloodstream, so either your cellulitis gets really severe, or you've got a really bad wound that's communicating, and you get your staph in there, and it gets into your bloodstream, then you can have sepsis. You can become so staph, once it's inside, it can stick. It's a very sticky bug, so it loves to stick to places. So it can stick to your heart valves, it can stick to your spine, it can stick to your kidneys, it can form abscesses basically anywhere in the body, and cause local damage and destruction of those organs. And that can be life-threatening. It kills people. We generally say a Staph aureus bacteremia, so that is where we've detected the bacteria in your bloodstream, has roughly 30% mortality. That's the figure we tend to quote, with treatment. So really serious infection. Then there's another level to it as well with so Ben Askren. I've still not seen if that's confirmed yet, but I'm fairly certain there's a certain strains of staph that produce a toxin. They don't all. Some of them do, some of them don't. Called PVL, which is a toxin that gets released by the staph, and it basically attacks your white blood cells, and that can cause a kind of toxic shock syndrome on the one hand, where your blood pressure drops, you become very, very unwell very, very quickly. But also it can cause really severe pneumonia, which is why I'm, as I say, fairly certain that this is what Ben Askren had. And essentially the staph can punch holes in your lungs, cause multiple cavities, and do extreme damage to your lung tissue with this PVL. So PVL is one of the conditions that we test for. So if we detect staph and you're having and we're worried about PVL, we would send it off to the lab to get tested to see if it's PVL positive, because there's often a public health. So if you have staph without PVL, you can take antibiotics, and so say you have a cellulitis, it's not PVL, you're not worried about PVL, you'll have a course of flucloxacillin, hopefully the cellulitis settles down, and that's about it really. If you have PVL, then it's much more important to think about, do you need eradication therapy? So where you take creams and what certain specific body washes and things to try and reduce the amount of it on your skin, arguably to try and eradicate it, but it's debatable whether that's truly possible. Do your family also, are your family carrying it? Are there other people carrying it? And that's of big concern for gyms, really, because you don't want this spreading in the gym environment. Staph, if you have, so obviously, if you're carrying staph and you don't have an infection, you may well spread it to somebody who didn't previously carry staph, but unless they have wounds or problems, they probably won't even know about it.
So that's sorry to interrupt,
Yeah,
but
no,
that
of
is a big bugbear of mine. And sometimes someone will come in with a staph infection, and then someone else will go, "Who's got staph in the gym? Who's training with staph?" No, that is not what's probably happened, is it?
Absolutely, yeah. So you may have picked up that staph, but
Yeah.
but there's also a really good chance that that person who's got the staph infection already had their own staph, and that's what's got in. Absolutely, obviously,
Wounds is the big thing, isn't it?
Definitely. If you've got open wounds, don't train. It doesn't matter where it is, doesn't matter how protected it is. You're getting sweat in there, you're getting other people's sweat in there. So if you didn't have staph, you might catch there. Just don't do it. It's the simple advice. With regard to the PVL staph, so warning signs for that is usually kind of recurrent big boils, which go away, come back, go away, come back, and that can be something that shows it's PVL because it's damaging the skin, so you get these boils. Obviously, I think I put this in a message on the gym group ages ago, but there are lots of other causes of boils. So if you're having boils, don't worry, don't panic. But it's probably something to see your GP about and just have a chat.
Is the other, because I've had recurring boils in the past, and I kind of fought my way all the way up, and I did end up seeing a consultant who went GP, walk in all the way, because they were constantly recurring, and they were very adamant it was contact dermatitis.
Exactly.
Yeah. And I was advised to use dermal wash, and that does help. And I still do get them sometimes, and when I do get them, and I do not train. That is a big thing, but they do leave scarring, and it is something to watch out for. But the questions like, fucking hell, I'm talking to you like the doctor. Well, you are, but like,
That's all right.
reassurance for myself. But there's a paranoia in jiu-jitsu now, is that like, if you're saying, most people have it, and we do, and there's a paranoia around the blame culture with jiu-jitsu, who's got it, who hasn't, and is there any, obviously you said don't train with wounds, is there any prophylactic, so preventative ways to stop stuff that you know of?
Cleanliness is key. So don't train with wounds is one, but cleanliness is key. So obviously, the cleaner you are before a session is good because you're just minimizing that risk. But also, the sooner you can shower and wash after a training session, the better, because anything that isn't yours, anything that isn't normally on your skin that you have picked up or whatever, you're going to get rid of it before it takes hold. I mean, that also works for things like ringworm. Anything that you have picked up, the sooner you get it off your skin, the less likely it is to kind of colonize and reproduce and be happy there. I can't, but I'm not pushing certain branding or whatever, but if I have some antibacterial wipes, and if I know I'm not going to get a shower for a while after a session, say I'm going straight home to look after my daughter, for example, it's going to be a couple of hours or whatever, I'll just give myself kind of a full body wipe down, just so I know I've had something.
Is there an active compound in that? Is it?
It's one of the proper.
Probably.
I can't remember, but there is it's something that's bactericidal in there, and fungicidal. I've seen no evidence. I've not looked at any data that says, oh, that works or that doesn't work or anything does it, but it just feels like it probably does.
Well, more than likely.
Exactly,
you know what I mean? It's
right?
like Trump saying inject yourself with bleach. He's not wrong. It fucking will kill shit.
Absolutely.
Yeah. Anything chloride based most of the time will kill shit. It's just, it's toxic to humans if it's within the but like, it's something refreshing, and like you see a lot in jiu-jitsu gyms. I see a gym down south now that's on a big, talking about, I know people that like will train in the morning and then they might just, forget to shower, you know what I mean? And then they get a shower 4 hours later, and that's well enough time for colonies to reproduce.
Absolutely.
But is there anything you could think about, like in terms of contamination control strategies for gyms? So, obviously keeping the mats clean.
Yeah, I
Is
mean
that a big
that's a
thing?
massive thing, because again, you don't want things reproducing down there. So yeah, absolutely proper cleaning of the mats. I mean, more or less constantly is the thing, isn't it?
Yeah.
In between classes, every time someone's been on there sweating loads, you want to get it clean before the next time somebody's on,
Yeah.
really. And again, I suppose it's the sooner you clean it, the less likely things are to have reproduced, taken hold, which would therefore be more resistant to cleaning the next time. I mean, cleaning is very effective with most agents, but the sooner you do it, the less work the cleaning has to do, if you see what I mean.
There's a big thing that happens in our gym, and I see a lot of young people do it. I've seen older people as well, and if Paul's listening to this, he'll probably laugh. Is someone will come on the mat and he'll go, "What's that?" And then they go, "Oh, I didn't know it was there before." So for the people who did not know it was there before, and they might have a wound, and they didn't even actually know, a little bit of mat burn might come up. What would you say is a good treatment for after the gym? Is there anything in particular you look at?
Wash it thoroughly. Things like TCP, any kind of antiseptic is worth making sure it's clean, and then keeping a really close eye on it, really. And if it starts to look red, get more angry, get painful, then see your GP as soon as you can, and get antibiotics nice and fast. It's never a thing where you've trained with a wound, therefore it will get infected. Nothing is certain like that, but it's certainly a risk, and it's something that to keep in mind.
Yeah. What about in terms of the soaps you use? Do you use a specific soap? Or?
At one point I was buying defense soap, but I'm not really convinced that there's any great benefit to defense soap over any other sort of soap. I think I was just taking in a little bit. I had ringworm, and I was very, very frustrated that I'd caught ringworm, and then so I bought loads of defense soap, and I was like, right, I'll use this all the time. But I mean, soap is good. There is no substitute for soap and water for kind of killing viruses, bacteria, fungi. It does a fantastic job. There are a lot of bugs in hospital where you have alcohol hand gel and things, and then we still wash hands with soap and water because alcohol hand gel isn't nearly as good. So proper soap and water. I don't think it really matters what soap is, as long as it's proper soap.
Yeah, because I sometimes use Dettol soap just out of paranoia from the gym, but it's still just got soap in it. And there's a funny story. I got defense soap because it made my skin feel really soft, and it was really nice. But I have a stupid habit during the winter, and it's the reason why my electric bill is so fucking high, and my water bill is because I like to get my shower have a steam function, so I'll leave it on for a bit. And stupid me didn't have it in the soap rack. I had it on top of where the tap comes off.
Oh yeah.
And that £12 bar of soap was gone after one use as it all melted. And left all this like horrible soapy scum at the bottom of my shower that took ages to clean out. And sometimes you can fall into that trap, can't you? And it's like, these are the questions that I think people would ask, is like, is there certain types of soaps or antiseptics to use? Sudocrem, is that also good?
Yeah, Sudocrem's good. Again, has a good, reasonably. It's quite broad spectrum. It's good for bacteria. It's good for fungi. It's. I mean, the fact we use it so much on kids is got to be encouraging, right?
Yeah. So the big takeaways so far, if I could clip this in any way, because I wanted for public health, big takeaways with staff is terms of don't train with open wounds.
Yep.
Keep your mats clean.
Yep.
Keep your body clean before and after.
Yep.
If you have any open wounds, antiseptics. Now the big thing I want to go on to it is treatment.
Sure.
So what's the go-to treatment? Is it to get your mate to give them a bit of acetic acid or have the rest of their fluoxetine?
No. Absolutely.
Definitely not.
No. So you knew that would trigger me.
Yeah.
Where to start? So most staff in this country so far is MSSA, which is methicillin sensitive Staph aureus, which is essentially means it's sensitive to flucloxacillin. So that's going to be the mainstay of treatment in the majority of times, but you need to have a proper course that's properly prescribed by somebody who's properly assessed you. Fusidic acid, you don't know if your staff is going to be resistant or sensitive to fusidic acid. It's not a guaranteed sensitivity. And therefore, you might just be making things worse and thinking you're winning. Taking somebody else's leftovers of Fluclox is really not a great idea because you don't know. I mean, first of all, is it even in date? And second of all, you're probably taking what's left over, half a course, quarter of a course. it might make you feel better, it might make things look better for 24 hours, but it's not going to properly get on top of it. Generally, we would treat a cellulitis for kind of 5 to 7 days generally, sometimes longer, and that would be either 500 4 times a day, or sometimes a gram 4 times a day, depending on the severity. So you, in the nicest possible way, if you're not trained on what you're looking for and what you're looking at, you don't know what dose to take, you don't know how long to take it for, it's best not to mess around and just get somebody to have a look, a proper medical professional, I should say. The other thing is obviously MRSA, so methicillin resistant Staph aureus, which is flu-clox resistant. There isn't as much of it here as there is in the US, but it is out there. It is out there in the community, and you don't know which you're carrying. You won't know without somebody swabbing it and sending it off to the lab. Flucloxacillin will have no impact on it at all. Fusidic acid may or may not. But all of those things, if you're taking somebody else's meds, are just delaying you seeing somebody and getting established on proper treatment nice and quickly, which just increases the risk that it's going to be worse.
Yeah. A few years ago, I had an argument with someone in the gym because they said I had it privately with them. They put it in the group chat. Someone put in, I think I've got ringworm, sent in a picture. It looked like ringworm. Someone replied, "Hi mate, I had ringworm recently. Got fusidic acid here. Didn't work on me. You can have it, see if it works on you." Now, there's also, a lot of people think about this not selfishly in any way either. Is the big issue is not just it's a health risk to you. Now you can take your mate's fluoxacillin and you might get better, but you're also considerably increasing the chances of that strain becoming resistant, aren't you?
This is the thing,
and that causes people's lives.
Yeah, absolutely.
And it can cause your own.
Yeah, totally. If inappropriate antibiotic use is probably the main driver of resistance. Every time bacteria are exposed to an antibiotic, there will be a tiny proportion of them that are naturally resistant to that antibiotic. The idea is you complete a course of antibiotics, and anything that is left, so the small amount of resistant bugs, will be demolished by your own immune system, basically. But if you're talking about half courses, quarter courses, a couple of doses, all you've done is killed off the things that are sensitive and left, or probably not even all the things that are sensitive, and left the resistant organisms that will then, if the infection isn't well enough controlled, then your immune system won't be able to overcome it yourself, and the risk is that the resistant organisms then multiply, and all of a sudden your sensitive bug you're now colonized with something resistant, which again might not be a problem this time round. You might be sorted, your skin might have healed, but next time round, or if you're in hospital in the future, it's a risk, and you're potentially then spreading that resistant organism around to everyone in your family. You don't know what the downstream ramifications are going to be, and ultimately we are having more and more of a problem in hospital and globally with more and more resistant organisms, and ultimately it's more and more of a challenge to modern medicine, not just in treating infections, but in cancer care, in surgery. All of these resistant organisms are much more difficult to treat, much more expensive to treat, and people don't get on treatment as quickly. So your chance of dying or becoming much more unwell with an infection is much higher because you're not on effective antibiotics fast enough.
Yeah. It's a scary thing, isn't it? And a lot of people try to use alternative treatments as well because antibiotics can be harsh on people. That's true. Any advice on that?
So by alternative treatments, you kind of mean like homeopathy and things like that? Yeah,
turmeric or honey.
So honey, incidentally, honey has some anti-infective properties, but
it doesn't kill.
No, exactly, no.
It doesn't have a mechanism of action.
Absolutely, the key thing is we use honey in some wound care, which is why that flagged in my brain. But yeah, you don't want to be using things that aren't going to work. All you're doing is delaying help. And the thing is, the vast majority of these things, I can't quote any papers, but the vast majority of these things does turmeric cure such and such. Somebody's tried at some point to have a look at it in a trial, and they haven't won, because if there was evidence that it worked, then we would be using it.
Yeah, because the NHS isn't it's not in this cahoots with the pharmaceutical industry to create more antibiotics. It's just trying to get patients out as quickly and effectively as possible.
Absolutely.
And the whole word's holistic, and the holistic approach is that you're using things that have multiple mechanisms of actions to kill things. Now, antibiotics, and there's so many different types, are literally created to kill
Absolutely.
the thing that is trying to kill you. Now, what do you want? Something that has a 10% chance of helping you? That, well, it's not even 10%.
Not even, no, I was going to say no.
It's way less, you know what I mean? It's probably your own immune system's fault it's off, but then
Absolutely.
you've also put everybody else at risk because you're a super spreader at that point, aren't you, as well?
Yeah, totally.
There's, a bit of advice as well is obviously don't train with it, but if you're walking around with staph infections, there's a reason why they go around to hospitals quickly. People aren't washing their hands properly.
That's true.
You're catching them off toilet seats, you're catching them off all these things. Staph is everywhere, and if you aren't someone that is vigilant about having an infection, that is also a big driver for it, isn't it?
Yeah, definitely, absolutely, really important to be aware of. So every time you rub your hand through your hair, every time you change clothes, every time you do more or less anything, you are shooting off millions and millions of dead skin cells, and those dead skin cells carry whatever bugs are living on your skin. So if you're somebody who's heavily colonized with staph, you are spreading that staph all over the place. So yeah, big important to be aware of.
And if you're waiting for your immune system to kill that off, in that meantime, you're giving it to millions of people.
Yeah,
well, not millions, but in turn, it could be millions.
Spread it, yeah, absolutely.
That's
if you're in the
strange.
wrong place, right time. Yeah, absolutely. If you've got something like a PVL, absolutely.
Yeah. And it could be a super spreader, and then it's developed no resistance. It's not had the opportunity to then be exposed to any antibiotics that would just fucking kill it. You know what I mean? And it's difficult because people want to train, people want to live their normal lives, but you look at Ben Askren and what happened, and it was caused by a staph infection. We know people personally in our gym that have ended up in intensive care units because of staph infections.
It happens.
It happens
all the time. You mentioned you said about where I've encountered it in my day job, and the answer is more or less frequently. We probably, and again, I don't have the figures, but we probably see 2+ Staph aureus bacteremias, so the really severe staph infections, a week, I would say, in microbiology. At least there's probably about 2 a week. I would say 2 to 4, 2 to 5 a week that we're called on to go and see, to offer advice, to help manage. So I see it all the time, and I see it in all sorts of different people. I've seen it in young athletes. I've seen it in old people who, have problems with diabetes and wounds on their feet as a result of that. I've seen it in middle-aged people of all sorts. I've seen it from people kicked at football matches. I've seen, it happens, and it really does happen. So equally, I suppose, yeah, the other message is, if you've got something on your skin that you're worried about and it's red and you're not feeling quite right, don't think, oh, that won't happen to me, because it could well be.
Yeah. We know people who are young, fit and healthy who have ended up really, really, really sick. And it's a part of the world we live in, and obviously the statistics you talk about, it's managed quite well within the community, we hope, and there's no reason to have this crazy paranoia that, you walk around the street and you touch something, you got staph. It's just keep yourself clean. If you've been in a position where you are soiled, is the correct terminology. Jiu-jitsu is something that's soiled. Doesn't mean you've actually been shat on, but you've been covered in billions of other person's bacteria. Just wash yourself. Make sure you look for wounds. Get the appropriate treatment. See the right people.